timekeeper will change the virtual background to indicate that the speaker's time is up. Anything said by the speaker after the 6 minutes will not be brought into the judge's consideration. While the debater is speaking, the opposing side can offer a point of information. The debater may choose either to accept or decline it. The point of information could only be raised by voice, not at the chat box. Point of information can only be offered by a member of the opposing bench from the 2nd minute to the 5th minute of the time allocated to the debater for a speaker to speak. Giving and taking point of information must be done politely. A speaker should also not be rude, abusive, or show aggressive behavior during this debate. After all the debaters have spoken once, the first or second debater of each side gives a reply speech, with the opposition team presenting their reply speech first. There will be no point of information during the reply speech. 3 minutes will be given to both teams to discuss among their team members and prepare for their reply speech. The timekeeper will change the virtual background once the preparation starts and ends. During the reply speech, the timekeeper will change the virtual background once at the 2nd minute to signal that the debater has 1 minute left. At the end of the 3rd minute, virtual background will be changed to signal the end of the debate. Without further ado, allow me to introduce the judges and the debaters. Today's debate will be chiefly adjudicated by the Honorable Colonel Dr. Muhammad Asri Bindin. He is a consultant in restorative dentistry in the Malaysian Armed Forces after joining the military in 1995. He graduated from University Malaya in 1994. He did his master's at the Newcastle University, United Kingdom in 2000. He also has the Bachelor of Laws from UiTM and a master's degree in Health and Medical Law from the University of Melbourne. For the second judge, we have Dr. Firstin Kelsey Hartanto. She graduated from Dental Faculty, Universitas Trisakti in 2007. She continued to study oral medicine and oral pathology at University of Malaya in 2010 and received the degree of Master in Clinical Dentistry in 2014. She is working as a lecturer at the Faculty of Dentistry, University Trisakti, and is entrusted to be the head of Oral Pathology Laboratory. She is also the representative council member of Asian Society of Oral Maxillofacial Pathology from Indonesia and secretary of the Indonesia Association of Oral Medicine Specialists. Her research interest is in oral potential malignant disorders and oral cancer. And the last judge is Dr. Nur Azlina Mohamad from University Islam Science Malaysia. She graduated from University Kebangsaan Malaysia in 2003 and worked as dental officer in Ministry of Health for 4 years. And later, she joined Faculty of Dentistry as a trainee lecturer. She then pursued her postgraduate study in conservative dentistry and graduated in 2012 from University Malaya. She currently working as senior lecturer and restorative specialist in University Islam Science Malaysia for the past 10 years. Ladies and gentlemen, the motion today is this House believes that the dental degrees should be extended to 6 years to ensure production of highly competent practitioners during this pandemic period. Supporting the motion today is the government team from Cook Institute of Dental Sciences that led by Shabnam Shrin, and the team members are Neha SM and Parnika Mishra. Opposing the motion today is the opposition team from University Technology Mara that led by Aina Hasni bin Badrun Sham, and the team members are Ahmad Izzat Arif bin Arif Amron and Asilah Rahimi. With the power vested in me as the Speaker of the House, I hereby declare this debate starts now. To open the debate, I call upon the Prime Minister today.
Good afternoon to one and all present here. We are gathered here today to debate on a very important motion, that is, dental degrees should be extended to 6 years to ensure production of highly competent practitioners during this pandemic period. And we, the government, strongly back this motion. Now, ladies and gentlemen, allow me to point out some key points in order to support our stand. We know that pandemic is an outbreak of a disease that occurs in a wide geographic area and affects exceptionally high population. COVID-19 impacted more than 200 countries all over the world. By March 2020, the majority of countries all over the world had to started imposing lockdowns and dental practices were asked to cease temporarily. Ladies and gentlemen, we know that this pandemic has given several shocks in almost all sectors around the world. As we all know, this affected our educational institutions. In India, around 250 million students were affected due to college and school closures at the onset of the lockdown. The gravity of COVID-19 pandemic has led governments and institutions to take draconian measures with regard to ongoing education. However, COVID-19 also have acted as a catalyst for digital adoption in our education system. The patient interaction with professionals, especially dentistry and ENT, came to an abrupt end temporarily due to social distancing norms of pandemic. But ladies and gentlemen, we know that dentistry requires proper training and practice. One of the biggest challenges dental students faced was to stop direct patient care, which is a key component of dental curriculum. One cannot deny that didactic and clinical skills are two different outcomes of education. No virtual sessions can duplicate the close experience with patients. Ladies and gentlemen, dental councils around the world defines dentists as being scientifically oriented, professionally minded practitioners who adhere to high standards of ethical and professional conduct and who can practice safely as a member of healthcare system. These criteria represent our baseline outcomes which cannot be compromised. Fortunately, e-learning has proven to be successful adjunct and has definitely impacted the environment in which medical students learn. But some disciplines seem to be function well this way. However, this cannot be applied in its pure form for all the subspecialties. For instance, in disciplines where patient care is a primary goal, students need to attend clinics and provide patient treatment while acquiring these competencies. Although new technologies with simulation and virtual reality techniques are gaining more interest, the direct in-person experience is still something which cannot be replaced. Dental students have lost a major part of their curriculums due to the pandemic and lockdowns. We acknowledge that the current lack of adequate undergraduate training will definitely reflect on the overall preparedness and confidence of our graduating students. Multiple questionnaires were conducted, and I would like to take one of the questionnaire conducted by Jordan University Hospital as an example. The questionnaire comprised of two main themes. One is the attitude towards e-learning, and the second one is self-preparedness of dental practice. And in this questionnaire, a majority of students, that is 76.8%, without significant effects of gender or year of study, agreed that they missed educational experience as a result of pandemic and lockdowns. According to 4th and 5th year dental students, the dental subspecialties most negatively affected were conservative dentistry, followed by prosthodontics and other subspecialties. Nearly one-third of the 5th year students are not sure of their confidence in the skills acquired before graduation, and nearly two-thirds of them prefer to be mentored or indirectly supervised after graduation. Only 28.2% of the students have confidence in starting an independent practice after graduation, and therefore majority prefer to have a well-structured year of residence with proper training after graduation. Because without any doubt, dentistry needs practice and ample clinical exposure. Dental institutions are now facing a different era with new guidelines.
POI,
Yes, I accept it.
the research that you have been trying to explain at this moment, is it related to the COVID-19 pandemic? Thank you.
Yes, of course, it is related to COVID pandemic because initially, when the pandemic began, there was lockdowns, and there was a temporary closure of colleges and schools where the students were not able to do the clinical practice on the patient. So according to this survey is mainly aimed on how the students felt about the e-learning and how confident they were after the pandemic to start their practice as a dentist. So I think it is relevant to the topic. I would continue with my speech. Dental institutions are now facing a different era with new guidelines implicated to ensure the safety of dental team. Their responsibility is not only within providing adequate education, but to make sure students are competent enough to face the new work challenges. Clinical training cannot be substituted entirely by distant learning. Therefore, the setting must be modified to allow a safe working place. Everything we do is practice for something greater than where we currently are. Practice only makes improvement. So we as government strongly back this motion of the House and believes that dental degrees should be extended to 6 years to ensure the production of highly competent dental practitioners. Thank you.
I call upon the leader of the opposition team.
Hello, am I audible and visible?
Yes, you are.
Education is passport to the future, and for tomorrow it belongs to the people who prepare for it today. Assalamualaikum and a very good afternoon. I bid to the panel of adjudicators, worthy opponents on the government side, accurate timekeeper, and my comrades on the opposition side, and also members of the floor. Today, this side of the house will provide you with informations, elaboration, as well as evidence on why this house is against that dental degrees should be extended to 6 years to ensure production of highly competent practitioners during this pandemic period. The leader from the affirmative gave an adequate definition of today's motion. However, their definition as a whole was a bit narrow, and so to define today's motion as a whole, it is a concept in which the dental course of study should be prolonged for 6 years during the pandemic to produce a highly knowledgeable and skillful dental practitioners. However, we as the opposition team, we believe that this statement is false. As the first speaker from opposition side, I will deliver my rebuttal and provide with an argument declining the motion with my first point, which is dentistry is already a lengthy course of study. My second speaker, Mr. Izzat Arif here, will deliver his rebuttals and provide you with two sets of arguments. The first one, he will be talking on how today's motion, it disrupts the administrative management of the dental program. And the second argument from Mr. Izzat will tell you on how 6 years extension of dental degrees will affect the student financial plan. Last but not least, my third speaker, Ms. Asila Rahimi, our whip, will deconstruct today's debate and tell you on why we should win. Ladies and gentlemen, the first speaker from the affirmative team has tried to tell you that undergraduate training reflects on the students' confidence. We are not denying the fact that practice makes perfect. However, let us all bear in mind that 1 year, which is equal to 365 days of additional year of study, which can challenge the students' mental health well-being. Hence, can you correlate between the confidence that can be gained and the mental health well-being that might arise due to these conditions? Now let us go back to my argument, ladies and gentlemen, members of the floor. A statistic provided by IDP Malaysia, an overseas education consultant, revealed the total of 381 dental study courses worldwide. And most of the degree in dentistry is at least 5 years long of intensive education. Well, this brings me to my first point. We are against that dental degrees should be extended to 6 years to ensure production of highly competent practitioners during this pandemic period because, thank you, but let me proceed first. during this pandemic period, because dentistry itself is already a lengthy course of study. The process of becoming a dentist, it can be very competitive, which is most evident in the admission process of dental school. In Malaysia, the minimum requirements before enroll in dental school is to have either Malaysian High Level of Education Certificate STPM, A level, diploma, matriculation, or foundation in science that can take up from 1 to 3 years of studies. After finishing the education requirements, only then we are allowed to apply for a degree in dentistry that is typically 5 years long. In certain countries such as the United States of America, an aspiring dentist, they can expect to become a fully licensed after 6 to 8 years of education. This is because students take typically 3 to 4 years in an undergraduate program to complete a bachelor's degree before they can add in another 4 years in dental school to become a licensed dentist. Now, let us all add up the numbers. A total of 6 to 9 years are required for a dental student to be called as a licensed dentist. It is not a short amount of time, ladies and gentlemen. 345 days in Argentina, 298 days in Germany, 185 days in New Zealand, and a total up to 2 years in Malaysia. These are the amount of lockdowns in various countries during the rise of COVID-19. We are all affected with the situation, but we have started to adapt. So, how we can be sure that by adding additional of 1 year of study can increase the competency of the student? After all, dental students are human too. We get tired and we get depressed when we are overworked. So, does it really worth it for us to jeopardize the students' mental and physical well-being for an uncertain future picture? Ladies and gentlemen, not that we are against the concept of people who is furthering their study in their 30s, 40s, 50s, and so on. In fact, they are very inspiring. But we are against that the dental degree should be extended to 6 years to produce a competent practitioners, when the big question here is, again, how can we be sure that the 6-year graduate is highly competent with the 5 years graduate? Hence, ladies and gentlemen, with the argument stated earlier, this House disagree that dental degrees should be extended to 6 years to ensure production of highly competent practitioners during the pandemic period. With that, thank you.
Thank you for your speech. Now I call upon the second speaker from the government team.
Good afternoon, everyone. In continuation to the first speaker, I, the member of the government, supports the motion. I would like to quote Peter Drucker. He said, "Today, knowledge has the power. It controls access to opportunity and advancement. The advent of the pandemic was an unfortunate event, and it has sabotaged many lives. As we recollect the initial days of the pandemic, we can think of the clueless faces with fear imbibed in their eyes. We weren't sure about the etiology, the pathogenesis, or any other relevant details. The only thing we were aware of was that it started off with a fever, headache, and cold, and it was fatal. Soon, they discovered it was transmitted from close contact with the infected, and the aerosol was one among the mode of spreads. As dentists, we are the people who closely work with the oral cavity, which puts us at a higher risk of exposure to the pathogens. Back then, many countries observed nationwide lockdowns. Thereby, a lot of compromise had to be made with the clinical batches, as a complete lockdown had restricted treatments to a bare minimum. Only emergency procedures were performed. Even as the lockdown was uplifted, the guidelines were eased. The aerosols were still a challenging factor for the transmission, which still continued to pose a threat to the spread of infection. Hence, they had to limit the number of aerosol procedures done daily. The aerosol procedures are a major part of dentistry. Restricting its usage not only affected the working class of dentists, but also the dental students, as the clinical exposure was reduced. Therefore, the extension of dental curriculum would help make up for the loss. An emergency response to COVID-19 pandemic is the culture of the new normal. The patients are no longer treated as a first come, first served basis. Instead, they are triaged as per the emergency of the procedure and are treated on the series of appointments. This could increase the time needed for the exposure. When we talk about adaptability, we are experiencing the advent of the new protocols and the revised guidelines that we are still adjusting to. Therefore, it is essential that the students be given ample amount of time and patient exposure to practice the same. Hence, there is a need to extend the duration of the course to 6 years during the pandemic. It requires time and great deal of effort to coordinate and run a dental practice. During the pandemic, we need efficient dentists. In order to be efficient, you have to be confident enough to perform. So 6 years would definitely sharpen the skills of the budding dentist. As I have said earlier, with the advent of the new protocols and guidelines, as the practitioner is adapting to the new normal, it is essential that they are trained to manage time in the series of organization, prioritization, planning, delegation, and stress management. While established dentists were taking time to adapt to the new normal, it's illogical to expect students to adapt to it without giving them ample amount of time. Ladies and gentlemen, let's talk about communication. Due to the presence of mouth mask, face shields, a miscommunication may occur wherein the patient may not fully comprehend what the dentist is trying to convey. There's always a lot of confusion arising as it is difficult to hear clearly. Due to the presence of mouth mask and face shields. Hence, I respectfully deny.
Thank you.
Hence, in order to adapt to it, it is essential that the students get used to the revised new norms for which time is an essential ingredient. In conclusion, I would like to say that the aim of the government is to bring forth confident and competent dentists who are efficient in their jobs. The new normal, along with maintaining dentist-patient relationship, has become difficult to be sustained within the 5-year course. Hence, I strongly recommend this extension of a year will help to bring about the same. Thank you.
It's now time to hear from the second speaker of the opposition team.
Am I visible and audible? Test mic. Am I visible and audible?
Yes.
Okay. Life is like riding a bicycle. To keep your balance, you must keep moving. Assalamualaikum and a very good afternoon. Firstly, I bid to the elegant chairperson, honorable panel of adjudicators, honest timekeepers, opponents from the government side, wonderful teammates from the opposition side, and members of the floor. Before I proceed, as the second speaker from the opposition side, I will be rebutting points that were given from the first speaker and the second speaker of the government, and I will be laying out two of my points with strong evidence on why the opposition strongly disagree on the motion that this House believes that dental degrees should be extended to 6 years to ensure a production of highly competent practitioners during this pandemic period. Firstly, from the first speaker of the government, she stated that how are we going to ensure that our dental students are competent enough to graduate without the extension of the 1-year program? But as we all know that as a first-year dental officer in the working force, we would still be supervised by dental officers. So being supervised by dental officers show that how competent we are in our working force. And secondly, according to IBM, they stated that participants that learn online learning is 5 times to gain more materials in online learning courses than compared to traditional face-to-face courses. Hence, this proves that online learning gives students full control over their own learning procedure and at their own pace. So this proves that online learning has been to be shown effective for students undergraduate students. So which is contradicting to what the first speaker has stated from her point stating that online learning is not efficient. And the second speaker has stated that we require a number of dentists to ensure to curb the pandemic. Yes?
So you have said that it will apply to everybody. The training will be applied to everybody, but you will be supervised by your dental officer.
Yes.
How does it apply to all the countries or just Malaysia?
In Singapore itself, a first-year dental officer who is graduated from dental school will be supervised by dental officers in accordance to ensure that they are competent enough to treat in the public sector. And the second speaker moving on to the second speaker, she said that we require a number of dentists in order to curb the COVID-19 pandemic. But if we delay the graduating students, how are we going to get enough number of dentists to curb the COVID-19 pandemic? So a little bit of history, ladies and gentlemen. In Malaysia, the first case of COVID-19 was detected in January 2020 and was tracked back to 3 Chinese nationals who traveled to Malaysia via Singapore and had come to close contact with an infected person in Singapore. Immediately, Ministry of Health of Malaysia devised standard national guidelines for management of COVID-19, and on March 18, 2020, the first lockdown, or known as the Movement Control Order, was implemented. According to Hung et al., global efforts to mitigate the spread of COVID-19 left no aspect of daily life unaffected. University students were not left out, as many educational institutions were forced to close their campuses and transition from face-to-face learning to online learning. Dental students in particular was massively affected, as the United States of America Occupational Safety and Health Administration placed persons involved in dental procedures and education in the very high risk category for viral exposure, because we undergo procedures which generates aerosol. So also in India, and on the evening of March 24th in 2020, the government ordered a nationwide lockdown initially for 21 days, limiting movement of entire of 1.38 billion population of India as preventive measures against COVID-19 pandemic. So what I would like to say, moving on to my first point, is that why we, the opposition, disagree with the motion dental degree should be extended to 6 years to ensure production of highly competent practitioners during this pandemic period, is the extension will disrupt the administrative of the management of the dental program itself. As we all know, the number of dental students intake in the country is always regulated by the country's dental association, like in Malaysia, Malaysia Dental Association, to avoid overproduction of dental graduates. Hence, the facilities of the faculty has been provided just enough to compensate the exact amount of students enrolled into the program. So by implementing the extension, initially the program was compensated for 5 batches of students, but now has to compensate 6 batches in total. Hence, this will cause a disruption in the timetable and scheduling, as students will be forced to share dental chairs with lack of materials and equipment, and also supervision by our doctors and clinicians will be disrupted because due to the lack of manpower. And moving on to the next point, as we all know, dental programs are one of the most expensive courses worldwide. Hence, students' financial plans will be affected. To enter this course requires a lot of planning and sacrifices in terms of finance. And in Malaysia, most students will aim to get a scholarship to ease the burdens of their parents. Also, some may take loans just to pay the educational fees, which not included on costs for daily spendings and educational materials. Hence, with the extension, terms and conditions of scholarship and loans will be breached. And there will be disruption in the terms and conditions where students have to extend their scholarship and loans through a tedious procedure, while those unfortunate will have to work harder and increase stress and burden through finance to obtain their enough money to pay their educational fees. Hence, there will be an increase in financial stress. So that is why we from the opposition side totally disagree with the motion that this House believes that dental degree should be extended up to 6 years to ensure production of highly competent practitioners during this pandemic period. Thank you.
Thank you to the speaker. To end the first part of the debate from the side of government, I call upon the government third speaker.
Am I audible and visible to all? Yeah, okay. A very good afternoon to one and all present here today. So I shall be the rebuttal from the government side. So speaking to you, I would like to highlight to you, our first respected speaker from the opposition has told us that she will give us the information, elaboration, and evidence to prove to us why we shouldn't have a 6 years long extension. But having said that, before we begin, she has spoken to us about how dentistry is a lengthy course and adding one more year to it would increase the burden. So she stated to us how they have been through a diploma or degree and need to have high grades, and that is how they come into dentistry. So, madam, respectfully, whoever enters dentistry, wouldn't they already be well aware what they are stepping into? They already know the number of years that they will be going into. So, having said that, they already know what they are going into. And COVID, the pandemic that has come into play, was an unfortunate mishap. We never saw it coming. So, once it has come, the damage has been done. We need to control the damage. So, we will try our best to repair whatever we can. The only aim as the government we see is to bring about budding dentists that are confident, competent, and efficient. So, in order to do that, the best solution we can come up with is to extend the year, as my Prime Minister had spoken earlier, is by giving them patient exposure. During the pandemic, the patient exposure may be comparatively lesser, but like I said, something is always better than nothing. Moving on, we have spoken about how it is a lengthy course again. So it is dentistry, medicine are all lifelong learning processes. We will learn throughout our life. Also considering it is a very dynamic field. There are continuous changes that are being brought about, continuous theories and continuous acceptance and rejections on various theories that we come in with. We spoke earlier about being supervised under dental officers. In terms of certain nations, that may be relevant to some extent. But speaking on a global platform, the relevance of the same is questionable. The next thing I would want to talk about, as you have stated, is the economic burden that it will be putting on the students. So, is dentistry the only field that was affected by COVID? I don't think so. Every field was affected and everybody is trying to cope up. But even as they are coping up, they are covering up for all the damage. As dentists, it was in our hands that we have to understand that the students have lost out on a lot, especially the clinical batches. They haven't experienced
OI?
interaction. Yes, ma'am.
Okay. Regarding your statement earlier that every dental student should know what is waiting for them when they are entering the dental degree. How about the student who is already in the second, third, or fourth year of study and they needed to prolong the study due to the pandemic? Meanwhile, when they started to enroll in this dental course, was for only for 4 or 5 years. Thank you.
Thank you for your question, worthy opponent. Like I stated earlier, when we enter into this course, I am assuming we're all 18 plus. So even when we walk in, we have the maturity that we know what we are stepping into. And if we are a second year or a third year student, nobody, even a 50-year-old, wouldn't have seen the pandemic coming. So wherever we are, we have to face it. We don't have another option. So even if you are a second year student, you wouldn't have seen the pandemic coming. So now that the pandemic has come, the only thing in your hands is to
Right.
deal with whatever you have. Yes, sir.
Right. Okay. You said that there will be a question in competencies of dental students graduating due to the pandemic without extension. But even to graduate, we would have to require our minimum clinical exams and also expected clinical exams to prove
That
our
is the
competency.
aim to
So how
extend the year,
would that
sir.
clarify you?
When the sole intention of extending the year is to give them ample patient exposure, which you are cutting down by saying that you don't have to give them the patient exposure. Moving on ahead with my speech, like we spoke about the economics, the lengthy course, and the disruption of the administrative management. So, COVID did not only affect or did not disrupt only the dental field, it has disrupted every expertise, every field. But what is in our hands to cope up with it and repair whatever has been damaged? So, I do agree that yes, disruption has been done, but which part of the world or society was not affected? Like it has been stated by my worthy opponents, there was a world nationwide lockdown seen in many countries. So, all these nationwide lockdowns, every sector, every society had been accepted. So you have told me that you have 5 benches in 1 year. So if you bring in a sixth bench, it would bring about disruption. But isn't disruption better than having dentists that have been mastered in machines and not have had human interaction? stating so, I would like to end my speech. Thank you.
To end the first part of today's debate, I call upon the opposition third speaker.
Am I visible and audible? Nobody can go back and start a new beginning, but anyone can start today and make a new ending. Assalamualaikum and a very good afternoon. I bid to Miss Chairman, the honorable panel of adjudicators, the accurate timekeeper, worthy opponents from the government side of the house, comrades from the opposition side, and dear members of the hall. I'm Asila, and as a member of the opposition side this afternoon, I firmly stand against the motion proposed that this House believes that dental degrees should be extended to 6 years to ensure the production of highly competent practitioners during the pandemic period. As the third speaker, I will provide all my rebuttals and finally restate why our side of the House strongly disagrees with the motion proposed today. So, my dear ladies and gentlemen, the Prime Minister from the government has mentioned that students lack undergraduate training due to the pandemic, but we have seen 2 batches that have been graduated with 5 years and not needing to extend. These 2 batches above us are affected by the pandemic, and they are also able to graduate without having to extend to 6 years of their program. And adding to that, there are minimal clinical experience and expected clinical experience that has been revised by the Malaysian Dental Association. And I also believe that there are clinical requirements that have been revised by other dental associations in other countries. We cannot question that these revised requirements are producing incompetent practitioners, because this has been gone through many stages to ensure that, to implement on the students and to ensure that these students can graduate competently. And moreover, further training, as has been mentioned by my second speaker, further training can be done during the first year. Yes, ma'am.
Ma'am, you have mentioned how the 2 years of batches that have graduated now are highly competent and efficient, ma'am. Ma'am, is there any evidence that you can quote to me that can tell me that they are highly efficient and competent?
Thank you so much for your question. I believe that these students that have graduated and has entered the national services are highly competent because they have seniors to guide them, to get them through this to be able to treat patients competently. So I believe that these patients and these students who have graduated without having to extend are still competent because they have undergone minimal clinical experience and expected clinical experience that has been revised by the government, by the Dental Association, to make sure that they graduate competently. Thank you so much for your question. I'd like to move on with my speech. So in this case, the risk outweighs the benefits to extend the dental degree to 6 years. And the second speaker from the government has also tried to tell you all that aerosol is a threat because it is the mode of transmission of COVID-19. I definitely agree with that. But even without the extension of dental degree, currently we do have a guidelines for aerosol generating procedures. So in this case, and the argument that has been provided by your team, it is irrelevant to extend the degree. And the second speaker has also talked about miscommunication between the patient with the mask and face shield. Yes, please.
Ma'am, you have mentioned that there are guidelines that will help the aerosol procedures to be performed in the clinics. Ma'am, how do you know that globally it is the same guidelines that have been followed? It has varied from nation to nation, and the patient outflow has been decreased with time, and the amount of patients that a person can work on has reduced. The clinical exposure has been reduced. So yes, they are.
Thank you so much for your question. In Malaysia, there is a strict aerosol generating procedures for this aerosol generating procedures to be conducted in clinics. They have their own room to treat these patients that needs aerosol generating procedures, and they have specific personal protective equipments to protect the practitioners during these aerosol generating procedures. So I believe that these guidelines are followed by all the practitioners in this country. Moving on to my speech, the second speaker has mentioned regarding miscommunication between the patients because they are wearing face shields and face masks. But as has been mentioned by all of us, pandemic is an uncertainty. So are you saying that extending the course of study, we are able to communicate better as we can finally take off our mask? I strongly disagree. So because in Malaysia, we still have to wear our mask, even we are approaching endemicity.
POI,
And
ma'am.
COVID is very much around us. Thank you so much. I'd like to proceed with my speech. And lastly, the third speaker from the government has also misled you all to believe that we are well aware of what we are going to. Yes, we are aware that we are going into 5 years of course of studies. We wouldn't be here if we don't agree with 5 years, but we don't agree with extending into 6 years because the pandemic is not what we prepared for, and we only prepare for 5 years. We do not sign up for the pandemic. And lastly, the third speaker has also mentioned that dentistry and medicine learn throughout life. And this is something that has been mentioned by my speaker. We can learn more during the first year as a dental officers from our seniors and our supervisors. So this is contradicting with the points that you have mentioned. So, dear members of the hall, I will proceed to convince you on why our side of the house firmly stands against the motion that is proposed today. As aforementioned by my first speaker, Ms. Aina, dentistry program is already a lengthy course of study that is taking up to 5 years and up to 9 years when we include our pre-university programs. Dentistry is already a high demanding course. These students, their youth are robbed and can further lead to emotional distress and burnout. Is this what you mean by producing highly competent students? And moving on to our second point presented by Mr. Izzat, extending dental degrees to an additional 1 year can disrupt the administrative management of the dental program. The faculty was built to sustain 5 batches at a particular time. An extra batch in the faculty will lead to disruption of the dynamic of the faculty and overlap clinical session and insufficient dental chairs for the students. With the given justifications and evidence, our side of the house firmly objects the motion proposed that this house believes that dental degrees should be extended to 6 years to ensure production of highly competent practitioners during this pandemic period, as we believe that this statement is misleading. Thank you so much.
With that, the first section of this debate has ended. Both teams will now be given 3 minutes to prepare for the reply speech. The reply speech arena will begin with us hearing from the side opposition. Your preparation time starts now. Dear speakers, your preparation time is up. Now, I call upon the speaker from the opposition team for their reply speech.
Am I visible and audible? Everyone is in the same ocean, but not the same boat. The pandemic and lockdown has affected everyone tremendously, individually, and as a whole community. With poverty, unemployment rates at an all-time high during the pandemic, getting back to the norm was very much needed. Hence, if we implement the extension of dental degree, we will delay the students to graduate, as we all know how understaffed our medical and dental healthcare staffs are in the working sector. As the government side has given weak points on why the extension of the dental program is needed, they have failed to provide evidence on whether those students who have extended are proven to be competent as those students that have not extended. While my team from the opposition side has given strong points with evidence on why we disagree with the motion that the dental degree should be extended to 6 years to ensure production of highly competent practitioners during the pandemic period. My first speaker has stated that the first point is that the dental program itself is already a lengthy course of study, with evidence stating that in order to get a BDS, Bachelor of Dental Surgery, or Doctor in Dental Surgery, at least 1 year of foundation program and 5 year of dental degree, which is accumulated up to 6 years of undergraduate study. And the second point was given by me with evidence by stating that there will be a disruption of administrative management of dental program, whereby there will be an overlap of clinical sessions in between batches, hence leading to not enough dental chairs and overlap of supervision of clinicians due to lack of manpower. And last point given by me is that student financial plans will be affected as the extension of the dental program is disrupting on how students manage their finance. As we all know that dental degree is already a stressful course, so why should we add on financial stress? While next, my third speaker has rebutted all the points from the government side by stating stronger evidence and points on why we disagree with the motion today that the motion dental degree should be extended up to 6 years to ensure the production of highly competent practitioners during this pandemic period. That's all from me. Thank you.
Thank you, Izzat Arif. Now, to end this debate, let's hear the reply speech from the government team.
Good afternoon to one and all. We as government, we strongly back the motion of the House. It's not the strongest of species that survive, nor the most intelligent one, but the most responsive to change. So this House would like to quote, see, we as government, we strongly back the motion at the House, and we strongly back the motion as a global topic and not about a particular country or a particular region. So the aim of our government is to bring about confident and competent practitioners by giving them ample clinical exposure. And we still believe, and we strongly believe, that the practitioners before graduation should have ample clinical exposure. And as my friends in the opponent team said that we gave weak points, I would like to ask you that I couldn't find any evidence on which you guys have spoken. Now, again, telling about the lengthy course and all those things, was a dental student not aware of this? And as we said, see, everyone is adult. They can know. See, if we are in between some pandemic, there is no way that we can hide and run back. We have to face it. That is where the challenge is. And finance, it's not just affected on the administrative section of the dental college or just the student. It was a global economic crisis that happened. So I don't know how you can make that point relevant. And I have when we gave this speech, we have given an example of a study in which almost 76% of the students said that they didn't get ample clinical exposure and they are not confident enough to practice after their graduation. Well, only 28% of them were confident enough to practice. And as government, we will definitely look into the majority of people. We will pass a law only if the majority of people agrees to it. And therefore, we strongly believe that the dentistry should be 6 years during this pandemic period. Thank you.
Thank you for the speech. With that, The debate today has come to an end. We will have 10-minute break for the judges to do the discussion. To all the judges, please remain in the Google Meet for the discussion. We will now wait for the panel of adjudicators to give us the result whether the House accepts or declines the motion. Before announcing the results, I would like to invite Colonel Dr. Muhammad Ashri to give his comments and advice to the debaters.
Can you listen to me?
Yes.
Okay. Good afternoon, everybody. It's quite difficult actually for us to comment because it's quite both of the team are very are equally good, and I have to what do we say? I have to say that the decision made by the three judges are divided 2-1. One gave the win to one institution, and the other two give to another institution. But I do not want to make announcement on that, but I should just make comment. Sometime when we first see the motion is, sometimes we can say that it is one-sided. But after we have listened to all the debaters, it seems to be that you are well prepared and you are very good in delivering your points. But what I can comment is that sometimes when you are facing with when you are facing with POI, that's how we want to see how you respond to the question being given to you. And if you can clearly say, and if you can clearly answer, or if you can clearly rebut the question or the point made by the opposition, that will give you, to me, it will be better, and it will give you marks. It's very easy for you to give your opinion, your points, but it's very difficult to take on question. So that's why in selecting the best speaker, we would like to see those who can answer the question well posed by the other team. And yes, of course, pandemic is very unprecedented event. It's you don't know what is going to happen in not just 1 or 2 months, sometimes in 1 or 2 years. You still do not know what's to go on. And many other things are on speculative basis. So we are not too sure what to suggest, what to do. But I'm very happy to see that, either from both sides, the opposition and the government, all argue in different perspective. But the winner, of course, you have the content is a lot better, and the manner in what and the strategy that you use to convince the judges are more impressive. Thank you.
Sorry to interrupt, ma'am. You're on mute again, ma'am.
Sorry. Thank you for the comments, Dr. Asri. And now I would like to invite Dr. Firstin to give her comments and advice to the debaters.
Thank you. It is a great honor for me to be the external judges of these debate competitions. I just would like to add a little bit from Dr. Asri. For me, both teams were great in deliver their opinion with strong points. However, there were a few points that we have to give the mark, because such as the content, the language, the manner, and also the strategy that make us to have to decide who is the winning team as well as the debater. So I wouldn't give a clear comment, a clear opinion and I don't want to tell now who is the winner. Just we proceed for the next judges. Thank you.
Thank you, Dr. Firstein. Now, I would like to invite Dr. Nur Azlina to give her comments.
Assalamualaikum. I'm Azina. Congratulations to both teams. Both have done very well in delivering their points, which I think is quite enlightening. And both has their strength in delivering, but perhaps in terms of language and manners, some can be improved. And on the reply speech, it would be interesting to see if we could sum up with some the point in a more interesting manner. Okay. Other than that, I think both have done a very good job. Okay. And that's all for me. Thank you.
Thank you, Doctor, for the comments. Now, the results are now in my hand. The floor thanks the panel of adjudicators. We also thank both of the teams for being here today. With the power that has been given to me as the Speaker of the House, I hereby declare that the motion is declined. The best speaker of this round goes to Aina Hasni binti Badrunsham from University Technology Mara. Congratulations to University Technology Mara on winning this debate and Aina Hasni binti Badrunsham on being the best speaker. For the losing team, never give up and better luck next time. With that, the Parliament dismissed. Thank you.
Thank you. Are we finished?
Now, I call upon Dr. Harliana to give the winner prize.
Oh, okay.
Okay, can you hear me? Congratulate the winner. I'm okay for the winner. You will receive prize winning cash USD 100 ringgit. Sorry, USD 100, and we will and also for the best debater. We will share the prize money later on. Okay, thank you so much for the thank you all judges for the comments. And now we have a photo session.
Thank you.